Welcome back to Good Day Stateline. Dr. Kapur is joining us again this morning from Transitions Hospice. We're continuing our series about living well with a serious illness. We chatted about pulmonary disease before. You can find that clip at gooddaystateline.com. But this morning, we are going to talk about neurological diseases. So thank you for joining us to talk about this.
Thanks for having me.
Yes, so I know that neurological disease is something about the brain.
Yes, so neurologic disease is basically it has to do with the nervous system, and it could, an example of a patient that might come onto our palliative care service, progressive illness with neurologic, could be dementia, it could be Parkinson's disease, it could be Huntington's disease, it could be stroke. So those are some classic examples of patients that we take care of with neurologic illnesses.
And what are the common symptoms? Do they all have one in common, or is it a bunch of different things?
It's a bunch of different things, so different diseases will have different hallmarks, but typically a person will have a dementia at some point with the neurologic illness. And so if a person has a stroke, at some point, if they have the symptoms long enough and it affected a certain part of the brain pathologically, that patient's going to have some memory loss. And so that may or may not be mixed with other memory, diseases like Alzheimer's, because our brain controls our function and movement.
Sure.
So if your brain is going to go down from whatever pathologically is happening in there that causes the dementia or the disease, your movement's going to go down, and then it becomes a catabolic breakdown state. So then you unintentionally lose weight. And then what happens when you lose weight? You're going to maybe have skin breakdown, chances of infection, immunity issues.
So there's really a lot that can come from, noticing that these diseases someone has one of them. So it sounds like, it might be difficult to live well with this disease, but you're going to tell us how you can.
Right. So we not only support the patient, but the family, especially in dementing illnesses, which are neurologic. I'll kind of go to talking about dementia now. So Alzheimer's is our top cause of, dementia. And then we have Lewy body dementia, which is hallmarked by falls and hallucinations. And then we have mixed dementia, vascular dementia, which it can happen because a person has a lack of oxygen to the brain from a cardiac illness, a pulmonary illness, or simply a stroke, which also affected the vasculature, and then they have a vascular dementia. And then there's also frontotemporal dementias, and then dementias that go along with like Parkinson's and other movement disorders. So what happens is the decision-making capacity of that patient can change and alter at different points in time. We won't go too deep into that, but as the patient is going through the illness, we educate the family, we support the family. This is a lot of anticipatory grief counseling that goes along with it, but also reassurance. Not to infantilize anybody or any patient who has a dementia, but the idea is that there's going to be anxiety that comes about, agitation, because they can't remember. There's a lot of repetition.
Sure.
And because they can't remember, they just said that same thing. And so we have to comfort, reassure, use non-pharmacologic measures to support this patient as they go through the illness. Education is huge in how we handle these patients and educate the families. Then if they reach a terminal state, we can transition them to hospice care.
And so this is a huge reason why you want to, start working with hospice prior to needing it.
Right, so you want to get involved with a company like ours to do palliative care at the start of the dementia and when the patient is able to make decisions. Because once they lose that decision-making capacity, it's very difficult then to put plans into place. Then you have some conflict that comes up in the family. So it's better to know what that person wants. So we start that, we start doing the symptom management, we start guiding them, advocating. A lot of changes in disposition and location where they're going to live. Assisted living patients can't live in assisted livings anymore because they need more help. Then we sometimes nursing home, sometimes home. There's a lot of cost, financial stress, social stress. So we help guide that process. And then when they come on to hospice care, we continue to guide that process.
And I think especially with transitions, you may have to make some of these decisions and it's not comfortable for you, it's not comfortable for your loved one, and having that third person, having you guys be part of it as well, what you're talking about, everyone will trust that working together, because it is such a hard time for so many people.
Right, and we never want to think of every case as the same case. So the idea is that every individual has their own plan of care. I gave a talk to the nurses this past week on plan of care to all of our nurses. It's not our plan of care, it's their plan of care. Do they want our aides to be doing physical therapy? Do they want to continue antibiotics when we may not need them for comfort? These are specific parts of plan of care. It's always the patients, and that's the commandments at transitions. It's that we do hospice, well 24 hours a day. We're going to be there for you.
Summer is right around the corner, and that means summer reading programs. We're going to take you to Cherry Valley Library next to hear all about what they have going on, and we're spoiling your furry friends with a pet expert, Kristen Levine. Speaking of friends, we're so excited to hear about the new addition to our friends at Pink Heels of Winnebago County's Pink Fleet. So their new ambulance was just unveiled. The ambulance is named Peggy last Sunday, and it's named in honor of their most active Pink Heels member, Peggy, who's actually a 9-year cancer survivor. So they're so excited to share this with us. And they also have a 5K coming up on June 26th. You can get more details on how to be a part of it on their Facebook page. We'll be right back.